Welcome back to the channel. I recently shared a research study showing that a lot of patients with type 2 diabetes had really impressive results when they went on low carb for several months or even a few years. Most of them were able to put diabetes in remission. But what about fasting? Can you do the same thing with fasting? Or are there any studies out there showing the same results with fasting? Well, I know fasting works well for diabetes because a bunch of people have told me, like my email subscribers, many people have emailed me like, oh, I've been doing fasting. I've been able to get off my medications, improve my blood sugar, lose weight, blah, 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 blah. Also, there's tons of anecdotes out there on the internet if you check Facebook groups, etc. And also when I interviewed Megan Ramos, who works with Dr. Jason Fung, she talked about how they've put about 20,000 patients or more than 20,000 patients through various fasting regimens, and that many of those patients have been able to reverse their diabetes. So it obviously works, at least for some people, a pretty good percentage of people. And if you do it long enough with the right regimen, et cetera, it obviously works pretty well. But I don't know that there's like one big research study that kind of ties it all together. Correct me if I'm wrong. Feel free to put it in the comments. There's various reasons for that. Dr. Fung has commented about how a lot of times fasting studies don't get approved by the IRB, the institutional review boards, because they're worried about safety or whatever. So there's some limitations even for people who do want to put the research together. Sometimes they're not allowed to do it. But a few years back, Dr. Fung and Megan Ramos and a couple other people put together a case series of, it's just 3 patients, but there are 3 really interesting cases of these patients with type 2 diabetes and what they were able to accomplish on a fasting regimen. So I'm going to share a little bit about this case series because I thought it was super interesting and super encouraging. And I'll put the link below in case you want to read the whole thing to get a little better understanding. But I'll talk about who are these patients, how long have they had diabetes, et cetera, what did they do in terms of fasting, and what types of benefits or results did they get in terms of their blood sugar, or in other words, their hemoglobin A1C, also their body weight and waist circumference, the medications they were on before versus after. So overall, it was super impressive, super interesting results. Some of the statistics or the timeframes involved were kind of mind-boggling, actually. So I'll go ahead and walk you through the study now. All right, so here's the study that I'm talking about. So Dr. Fung was one of the authors along with Megan Ramos and a couple other people. And in the introduction to the study, they kind of explained that diabetes is common and it's often associated with obesity, and sometimes lifestyle changes can help, but there's a lot of challenges. Like people don't often make, a lot of times people don't make much progress just trying to improve their lifestyle, have a healthier lifestyle. They also talked a little bit about insulin and how, it's kind of unpleasant to use with all the injections and things. And that's not even to mention the fact that, injecting insulin has a bunch of harmful effects. So they didn't really get into that too much, I don't think. They also kind of compared the option of fasting with something like bariatric surgery, where you have a gastric sleeve or bypass or whatever, and how fasting can probably give you just as good results or better without such a crazy invasive surgery, which often has complications and so forth. So that was kind of what they talked about in the introduction to the paper. And then they got into the actual case presentation, the 3 cases. And in the little blurb right at the beginning of that, they said that these people they were on various medications for type 2 diabetes, and including at least 70 units of insulin daily. So they were suggesting they were all on at least 70 units of insulin daily. They give some other numbers below that are a little confusing because they're talking about different types of insulin. But they did say that they were on at least 70 units of insulin. So here's table 1, gives you a little more detail about the patients. So there are 3 of them. Here are the ages on the left there, 40, 52, and 67 are their ages. And then here's what I thought was interesting is they have had type 2 diabetes for 10 years, 20 years, and 25 years, respectively. So a long time, at least for 2 of them, and one of them pretty long as well. They have other health issues there in the middle column, like high blood pressure, high cholesterol, and one of them had kidney cancer and had a kidney removed and has chronic kidney disease. So a lot of the typical, comorbidities or other health problems, in other words, that people with type 2 diabetes have. And then they started to talk a little bit about their fasting regimen here. And then if you want to read the paper, they explain a little bit more about each patient. But let's go ahead and get into the actual treatment, or what kind of fasting they did, and then the results that they got. So they put the patients through a little bit of nutrition, education, and so forth, talking about macronutrients, and I'm sure they talked to them about fasting and things like that. So they spent some hours learning about it, so they didn't just start, completely ignorant and all that to what they were going to be doing. So that's a useful point. If you're wanting to do this yourself, you do need to educate yourself enough to know how to deal with the different medications and the dietary changes and so forth. But ultimately, these 3 patients, basically, they were all doing something kind of like alternate day OMAD, because what they were doing is they were fasting for 24 hours, multiple times per week. So either 3 times per week or every other day, which is similar, but not exactly the same. So if you think about it, if you fast for 24 hours about every other day, then basically what you're doing is having 1 meal a day every other day. Because it's like if I start a fast after dinner tonight and then I don't eat breakfast or lunch tomorrow and then I eat dinner tomorrow, that's my one meal tomorrow, then I will have fasted for about 24 hours. And then I would, eat the next day, but then start another fast after dinner that following day. So it's kind of like alternate day OMAD, which is not a phrase people usually use, but that's in effect sort of what they were doing, but it's also a 24-hour fast about every other day. So that's the kind of the regimen that they were using. And they were talking about how they started lowering their insulin doses pretty quickly. So they use less insulin, of course, once they start fasting, because you don't want to be injecting too much insulin and have low blood sugar and all that. And they gave their target blood sugar when they were weaning the insulin was about 180, to be under 180 on the United States scale, which is, I guess, about under 10 if you're in the UK or Canada or other places. So that's kind of what they were doing. Now let's talk about the results that they got. So they kept track of a few different things as they were doing this study, and that was how long did it take to get off insulin, what was their fasting blood sugar and A1C, their body weight, and their waist circumference. So those were kind of the main things that they were looking at. So let's go ahead and look at table 2, because that kind of summarizes all of this data, and I'll just point out a few things to you on this table. So they've got the 3 patients over there on the left, and then the second column is the A1C, hemoglobin A1C, and it's a little confusing because they have the United States numbers, which are the percentage, I guess, and then the UK or Canada, where they use the millimoles per mole. Is that what that says? Anyway, I'm more familiar with the United States version, but either way you can see the first patient went from about 11 to 7. Second one, that's their A1C before and after. The second one went from 7.2 to 6, and the other one went from 6.8 to 6.2. So they all had improvements in their A1C. And then the next couple columns are showing the before and after medications. And this is kind of the coolest part of this study, is that they got off all of their medications. 2 out of the 3 patients got off all of their medications. And then one of them continued to take this medication called canagliflozin, one of those ones that makes you pee out more sugar. Anyway, so 2 out of the 3 got off all their medications, and one of them was just taking one medication at the end. And then they show things like their weight loss in kilograms. So the patient 1 went from 83 to 73, patient 2 61 to 50, and patient 3 97 to 88. So they all had a significant amount of weight loss. And then if you look at the before and after waist circumference, they all had a significant improvement there. And then the last column is the most impressive thing of all. And this is how long it took them to get off of insulin. So how long did it take to get off insulin? Well, you'll note that the patient 1, it only took 5 days to get off insulin. 5 days. And the other 2 were 13 days and 18 days. So, wow. So those are some pretty crazy results. And perhaps the coolest thing is that they all got off insulin in less than 3 weeks. One of them only 5 days. So by fasting, and they were also reducing their sugar and carb intake somewhat, I think, on the other meals and things. But by fasting, they were able to very rapidly get off insulin. Why is that important? Well, because once you start using insulin as a type 2 diabetic, it's basically a downward spiral from there, because the insulin makes you get fatter. And as you get fatter, your blood sugar gets more poorly controlled, higher, etc. And then you might need more insulin, and then you have all these other harmful effects, and it's bad news. But if you can get off the insulin that fast, holy guacamole. Because, I mean, that's just like a huge, huge, huge step in terms of improving diabetes and even being able to reverse diabetes. That's a gigantic step forward that they took in a really short amount of time. And then they continued to do the fasting regimen and got other health benefits and so on and so forth during the ensuing months. So one other thing I thought was worth focusing on and highlighting specifically is what the patients said about how they felt on the fasting regimen or fasting diet that they were doing. So the first patient, they said, tolerated fasting without difficulty and felt excellent on his fasting days. And then later, patient 2, they said, patient 2 also subjectively reported feeling terrific and his daily fasting blood sugar, ... So feeling good. Patient 3 said he subjectively reported the fasting was easy and does not have the carbohydrate cravings he once had before he started the diet. And he also experienced higher energy levels. So that's pretty cool. This is a smallish sample size, obviously, but all 3 of them, subjectively felt good, had high energy levels, etc. One reason that's worth noting is in the discussion, they briefly compare this fasting regimen to how people who do really severe calorie restriction have had improvements in diabetes. They linked to a study that talked about that. But those people were having to cut their calories way, 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 way down to like 800 a day. And if you don't know, if you only eat 800 calories a day, you're probably going to feel like crap. In fact, the long-term calorie restriction studies that are out there basically say people feel like crap, but they have certain health benefits. And that's I'm talking about severe calorie restriction, not just a little bit. But the point is, fasting doesn't cause those types of side effects where you feel like crap. You can feel really good. You can have high energy as long as you approach it in a smart way. So that was pretty cool. And then in the discussion, they also talked about how these people reduced their risk of cardiovascular events and so forth a lot compared to if they hadn't done this fasting regimen and seen these various improvements in their body weight, their waist circumference, their A1C, their blood sugar, and getting off of the medications. So as I alluded to at the beginning, of course, this is just a small study and just kind of a taste of what's possible with fasting and diabetes. But since all these people had diabetes a really long time and they were all able to get off insulin really quickly, it's a pretty good taste about what fasting can do for diabetes. But if you want to get more details, one of the authors on this study was Dr. Jason Fung, and he wrote a book called The Diabetes Code. So he'll share a lot more details in that book. If you want to check that out, I'll put a link below. A lot more details about why fasting helps with diabetes and kind of what to know and what to do about it. Also, I'll put the link to the full study below if you want to read that. It's pretty interesting, so I suggest you read through that as well. And here's my interview with Megan Ramos, where she talked about how they've put a lot of patients through fasting in their program and all the health benefits that they've gotten, including putting diabetes in remission in many cases. Usually takes about 6 months, they said, to do that. She said that. And then here's a playlist where I go over a bunch of beginner intermittent fasting tips. So if you want to learn how to get started on the right foot with intermittent fasting. Thanks for watching. I'll see you next time.